It's a pleasure to be here today, and I'm not going to talk about mental health, but I'm going to talk about neurodegeneration, but these two things are, of course, really closely related. So dementia is a huge burden to the individuals themselves, but also to their close ones and to the society. A mild cognitive impairment refers to a stage between normal aging and clinical dementia, and it affects currently more than 10 million people only in Europe. And these numbers are predicted to double in the future 20 years. So this is a huge thing for all of us. And this group of mild cognitive impairment subjects is particularly interesting because we know that 20 to 50% of these people develop into clear clinical dementia in 5 years. So these are the ones that we should, in our clinical practice, try to find as soon as possible in order to be able to follow them and in the future also to provide a better medication and maybe even a cure for them at some point. This is something that my group has been now working on, and many other groups as well. And this is something where we know that AI also might be helpful, and especially combined with neuroimaging. We know that pathological changes in the neural networks can be observed already years before clinical symptoms of dementia, especially of Alzheimer's disease, can be seen. Alzheimer's disease is the most common of the clinical dementing disorders. And we know that at a structural level, at some point, these patients will have amyloid accumulation in the brains. But we nowadays know also that before these amyloids accumulate and can be detected with other methods, we can already see hyperactivity in the brains at the neuronal level. Most likely, the hyperactivity at the neuronal level in the brains causes the accumulation of this pathological amyloid. So this early hyperactivity could be a very important signal that we might be able to detect with neuroimaging measures that follow neural activity like magnetoencephalography and electroencephalography, so MEG and EEG. So in the end, these synapse level changes at the neurons cause first local neural circuit problems and then later on brain network level problems, which we most likely can detect then as clinical symptoms in these patients. So indeed, EEG and MEG have been used and can be used for this kind of measures. And for those of who are not familiar with these measurements, here you can see some of our younger subjects in our laboratory. So we can follow the brain activity at millisecond time scale with both EEG and MEG. And with MEG, we can also provide good spatial accuracy for the brain activity. And these are really comfortable measurements for the subjects. And these have already been used in order to reveal alterations, not only in Alzheimer's disease, but in the early stage, so already at this mild cognitive impairment stage. Indeed, MEG applied on control subjects and then age-matched subject with mild cognitive impairment can already discern important information related to power spectral densities in the brains. So the subjects with cognitive disorders start to have more slow wave activity, and they start to lose faster activity in their brains. But we can get even better measures when we go to look at more complicated measures, such as functional connectivity, so connectivity between brain areas, and especially when we bring together this with AI, we can get fairly nice results already. This is one of my favorite studies in this field. They're done by our Spanish colleagues who applied MEG to subjects with mild cognitive impairment and followed them for 3 years. And they, using fairly simple machine learning algorithms on the MEG data, they were able to predict who of these MCI subjects in 3 years were clearly progressing to a clinical disease and who were in a stable stage, where their cognitive problems most likely were related to something else than neurodegeneration as such. Well, our Italian colleagues combined this with genetic susceptibility, so they brought together AI, EEG, and gene information, because we know that there are certain genetic backgrounds which increase your risk for Alzheimer's disease especially. And they were already able to predict Alzheimer's disease with accuracy of 0.97. So sounds perfect. You would think that you just go to the clinic and that's it. But the truth is that the real life is not that simple. So when you go from the lab to the clinic, and completely new patient population, maybe to another country, and so on. Things are not that simple. So what do we need at this point? We need huge data sets and different kind of data, and then probably AI to solve this issue. And this is something that we have started to do in a huge European project called AI Mind, supported by the EU Horizon 2020. We have been collecting so far, almost all the subjects have been already measured several times. So altogether, 1,000 participants with mild cognitive impairment are in the project. We are following them for 2 years. They come to the EEG and in Finland also to MEG measurements every 8 months. And these measurements are combined with different kind of cognitive measures. So we have like AI tablet-based cognitive testing. Then we have kind of normal conventional neuropsychological testing. But then we also collect new blood biomarkers and we do genetic testing to find additional risk factors of cognitive decline from those. We will use AI at 2 different points. First of all, we are trying to find from the EEG and MEG responses those features which are the most predictive of the network disturbance. But then we are also combining this information with the other markers, so the cognitive testing, genes, and blood biomarkers, to have a kind of a more full assessment of the dementia risk. So this is a huge project, but like I said, so we have been successfully recruiting 1,000 subjects, and we just had the first ones coming for the 4th round. So it's going to get a bit easier in the future, but you can imagine how busy our lab has been for the last 2 years with this. So here's a couple of facts about this project. So this is, of course, needs a lot of collaborative activity. So we have 4 different clinical sites measuring the data in Norway, Finland, Italy, and Spain. But in addition, many centers who are contributing other things. For example, Aalto University is collaborating with their AI know-how, and there's lots of things related to the ethics and all these different aspects that are needed in order to someday have this kind of service as a clinical tool. And we are also collaborating, for example, with eBrains, which is a large European digital research infrastructure, which is trying to accelerate the collaborative research between different kind of organizations and researchers, so that we could have, for example, this kind of data sets and tools available more freely for all of us in Europe. So in the end, if everything works, hopefully someday we would have this kind of a pipeline. So when the subject has symptoms of mild cognitive impairment, he or she would visit first a doctor, have a clinical examination, then we would have an MEG or EEG study, possibly an automated analysis of that, and then maybe combined with cognitive testing, blood samples, whatever now comes out as the most important features of the cognitive decline. And then in the end, we would have the possibility to find those subjects who are really at the highest risk of development of Alzheimer's disease. We could already give them a risk factor recommendation. We know that we can slow down even the decline in Alzheimer's disease by affecting blood pressure, cholesterol levels, blood sugar levels, and so on. So this is already something we can do, and we know that there are several new medications coming at the moment to the field, which may have important effects for these patients, but they are also with many side effects. So we need to find those ones who are most likely to benefit from these ones. We don't, unfortunately, have a lot of results yet, but like I said, we have been mainly busy with collecting the data. We do have some minor things which I will now show you. So, for example, just looking at this very simple memory, functional connectivity things, we can already see clear correlations with our subjects' memory scores, even in fairly small subject groups. This is for 27 subjects in this particular figure now, but we can clearly see that our measures should work. So we'll see how it all goes in after the AI has done its magic in between as well. And we, of course, have ideas on how to now apply AI to this particular data set. We have already been using certain kinds of tools in MEG, EEG data in our group and in Aalto University in general recently. And we have been able to, for example, extract individual neurofunctional features reliably from MEG, EEG data. So we have been using this kind of Bayesian reduced rank regression method. It's an example of latent variable models, which aims to explain high-dimensional data with a small set of low-dimensional predictors. And this is actually the case when we have high-dimensional brain data, we have clinical data, we have genes, we have many, many measures. So we had to somehow deduct the information there. And this model has been very useful for us. We have been, for example, using it in kind of showing that you can find individual fingerprints from healthy subjects, even from fairly simple power spectral measures of MEG or functional connectivity measures. So that in this figure, we have been analyzing data from subjects who have been measured at different time points. So same subset many times between months or between tasks, for example. And the model can really nicely find the individuals from this huge data set. So this is something that we think that as a model might be really, really useful also with this new data set, as it also gives the possibility to combine many different kind of data with it. So gene, age, and other clinical information can be brought into this model fairly nicely. For example, we have been applying this to healthy subjects in our earlier studies. So, for example, we can really nicely find siblings from other people as data. We had a huge data set of hundreds of siblings, and this model was able to find kind of the heritable features in the data. And similarly, we have applied this approach to healthy children's EEG data and trying to predict age, kind of brain age in these children. We know that sometimes the brain age in children is different from the physiological age, and still the children are healthy, but they are developing at different pace, and it can sometimes be very useful to have an understanding of how these things relate to the cognitive development, for example. And this kind of model appears in our preliminary results to quite nicely predict the age in EEG. As you can see, there's a kind of a component extracted from the EEG data on the right side of the figure, which clearly has I think there's a gradient from younger to older subjects. So this kind of information can be brought into this model, and this is what we are now hoping to do also with our huge AI-Mind data set, and maybe find interesting things that will help us in clinic. And then, of course, comes the most important question that when are we then able to use this in clinical practice? And actually, we are about there. So the Netherlands has been a bit going forward with this kind of approach already. So in Amsterdam, they have a memory clinic which is already actively using MEG measurements combined with machine learning in some of their most difficult dementia subjects, in that that they try to predict and kind of discern what is the underlying cause of the dementia in this subject, and they are of course not able to provide this kind of service for all of their patients, but for the most difficult ones, where they don't know whether this is Alzheimer's disease or frontotemporal degenerations or many other of neurodegenerative diseases, they have been already able to show that MEG measurements combined with AI can give important information for the clinician in order to discern that what is the true underlying diagnosis of this patient. And to the question that when does AI kind of release doctors to do something else, I don't believe that will happen for a long time. So of course, all this still needs to be brought together with the clinical view of the patient and so on. But this can be a really important tool and can help certainly in predicting the future of the patient. So thank you for listening, and thank you for all the people who have helped in making this study true.